Everyone hear me? Okay. Before we get started, I would like to ask everyone that they please mute their mics. We have a lot of people on the call today, and we have two of us moderating to watch for questions, and we're going to do our best to monitor the screen. But if you do have a question, and you can put it into the chat, Corey and I will be monitoring that to make sure that Al's aware what the question is. And we've also left time at the end of the session, or during the session, I should say, to answer any questions that you may have. I also want to let everyone know that this session is being recorded, and we're going to use it for future education and training, and we'll post it on our website and Facebook and in our newsletter so people have access to that. And any of the participants who are not a part of CLA, we'll make sure that you have a link once we get that converted from Zoom to YouTube. So good morning, my name is Tanya Gagno, and on behalf of Community Living Algoma, I want to take this opportunity to welcome everyone here today. Not only do we have CLA employees in attendance, we have over, it registered 78, but I see we're at 79, so that's excellent, on the call, which include the following agencies. So we have members from the Town Council of Hornpain, Social Services Sault Ste. Marie, Kenora Association for Community Living. I see we have some board members on, and Community Living Brant. We have CLA's communication writer. We have a Huron Superior Catholic District School Board member, Community Living Greater Sudbury, Canadian Mental Health Association, Community Living Guelph Wellington, Community Living St. Mary's. So welcome everyone, and thank you for being here to share in our first training session as part of our Community Living Algoma Community Engagement Project. I would like to take this opportunity to introduce Al Condeluci. He's going to talk to us today about addressing loneliness and social isolation, the key to a better life. So Dr. Al Condeluci has been a leader in community building, human services, and inclusive advocacy work for the past 50 years. Holding a PhD and MSW from the University of Pittsburgh, Dr. Condeluci has been the CEO of CLAS, Community Living and Support Services, a major nonprofit community building organization in Pittsburgh, Pennsylvania, from 1973 to 2019. He holds faculty status at the University of Pittsburgh in the Schools of Social Work and Health, Rehab Sciences, and is author of 7 books, including the acclaimed Interdependence, The Route to Community, 1995, and more recently, Social Capital, The Key to Macro Change, 2014. In 2018, he received the Key to the City of Pittsburgh, the highest civilian honor that can be given to a community member. He serves as a consultant, advisor, and human service coach, and is one of a number of nonprofit boards and community commission on state, local, and national levels. He helped found and convenes the Interdependence Network and an international coalition of professionals, family members, and consumers interested in community engagement and macro change. And his contact information is at the end of his presentation. And so please welcome Al.
Great. Thank you, Tanya. And welcome everyone to this first of 5 training topics that we're going to be looking at as we roll out our community engagement project that Tanya had referenced. And before we get into this particular topic, the first of the 5 that are going to be a part of our training cycle, let me just sort of acknowledge a little bit of the history of the involvement that I've had with John Policicio and Tanya and the whole team at Community Living Algoma. We met, John and I met years ago, probably 8-9 years ago, at a conference, a Community Living Ontario conference, and I had the great pleasure of sharing some ideas at that gathering, and we talked a lot, both during the sessions as well as over some coffee after the sessions, about the frustrations that we all felt in the work that we do, which is supporting men, women, and children and families who are experiencing disabilities in participating in everyday life. And the irony is and was that any organization that provides supports to folks with disabilities um, have been at this goal for years. As Tanya did my introduction, for example, I've been, working as an advocate in the field in nonprofit, human services and disability services in the United States for some 50 years. And from the time that I got started in the field, the agenda was let's help people live everyday lives. Let's try to see what we can do to support folks who have been institutionalized and segregated and devalued in achieving some parity in our cultures and have been at it for some 50 years professionally, both in terms of running an agency very much like Community Living Algoma, as well as a family member, growing up in a large Italian family with my cousin who was born the same year I was, and we lived right next door to each other, and who had Down syndrome, and from my childhood experiencing how she was devalued and marginalized, not by our family, but by society, by culture, not necessarily maliciously or intentionally, but just by ignorance and misinformation. And that launched my career as an advocate, working with my cousin Carrie, being with my cousin Carrie, but then moving into this in a more academic, intellectual way, trying to learn why we have such struggle. Um, and so this series, this educational series, as part of our community engagement project, is really going to be focusing on helping us understand the information necessary to create engagement, better engagement possibilities for people. But in a way, this training session is also very generic because the topics we're going to look at are ones that affect all of our lives, not just our work lives if we happen to work in human services or we happen to work in disability supports. Certainly there's going to be relevance, but regardless of that intentionality, these topics are going to be focusing in on how we can create just a better community for all of us and for any of us. And so the things we're going to look at in this training cycle are today we're going to launch by exploring this whole phenomena of loneliness and isolation, and we're going to explore it very generically because every one of us on this call today have really been hit square in the face with finding ourselves in situations where we have to distance from people, and where with the pandemic finding ourselves really rendered to be lonely, and so each of us, regardless of who we are or where we come from, have experienced the pangs, the angst, if you will, of being isolated or being separated from people, which focuses on loneliness. So we're going to explore that topic today. But in this training series, and we're certainly invite you, certainly our guests who are with us today, to consider staying with us through this educational cycle. And we'll give some dates as we're moving forward, but we're going to be looking at not just as today, loneliness and isolation, but the antidote to loneliness and isolation is building relationships. So our second session, which is going to be on January 26th, is going to focus on relationships and what we know about them, how we can build them, and how we can strengthen relationships so that they're more robust. Um, Our third session is really going to be focusing in on understanding community and mapping our community. So we know where resources and we know where the places and spaces that people can take advantage of in terms of engaging in community. Um, the fourth session, which is going to be at the end of February, is going to be looking at the social infrastructure of our communities. How does community manifest, and how can we soften the social infrastructures of our community so that more people feel less isolated or less disconnected from each other? And then our last session, which is going to be in early March, is really going to focus in on some macro strategies, some things that we all can do to strengthen our communities. So that's part of our training cycle. And again, we're so delighted that you found your way here and are going to be a part of this. We welcome you to stay with us through this series. But the educational series that we're launching today is just one part of our community engagement project that Community Living Algoma is launching, because what we want to do is really a very intentional, strategic effort to get people more engaged and more connected. And so as we roll through these trainings, we'll talk a little bit more about some of the ways that we're going to address this and some of the more macro ideas that we're going to be launching. So again, welcome. We're delighted that you're here. As Tanya said, we're recording this certainly so that our staff and our board and some of our key stakeholders in the Algoma region who weren't able to be on the session today can actually participate by plugging in to the recording. And as Tanya said, we're going to be recording each of the sessions. And so, you're certainly welcomed to share some of these ideas with your colleagues and friends, maybe even invite some other folks to join in as we go through these training cycles. And know this, although each of these topics are going to be looked at, individually and in a very focused way in the training, they can stand alone. They certainly will be tied together. We'll tie them together as we're moving through, but each one of these are standalone and they really affect us in a very generic way. They're not specifically for, human service advocacy or human service work. Certainly they apply there, but these items can really be things we could share with our families and with our community and our neighbors. So thanks for plugging in, and we're going to get off to the show. And the way we're going to do this, I'm going to go through some content with you, some information to help set the table for understanding loneliness and isolation. But if you have any questions or comments, as Tanya said, um, put them into the chat room. Just use the chat feature of Zoom. We're all sort of familiar with using Zoom as almost a way of life, unfortunately. But put your questions in there or write them down, on your pad as you're paying attention to the things we're talking about. And when we get to the Q&A, we'll have an opportunity to engage them. We can engage the questions. Tanya and Corey will sort of go through some of the questions that are in the chat room. But if folks want to raise questions in a live way, we're certainly excited and happy to do that as we get to that point in the training. So that's sort of the format. We're going to be rolling into these topics. One last point before we get started is know that Tanya did send out this PowerPoint that we're going to be using. as well as some handouts. And I'm going to refer to the handouts as we go through. So if you had the opportunity to download and maybe make copies of those handouts, keep them handy because I'm going to be referencing them. We're going to actually be looking at them a little more closely as we move through this. If you haven't received the handouts, then you're going to want to, notify Tanya. She'll make sure she can forward those to you so that you have them as part of this session. For each of the sessions we do in this training cycle, we're going to be having a PowerPoint that will capture the information, and then handouts or white papers or exercises actually that we're going to look at doing as we go through those topics. So we'll have those for each of the sessions, so that if you want to create a little workbook or a folder where you can keep these things, if you're going to stay with us through these 5 sessions, that would be great because they're going to correlate and they're going to build off of each other. So with that in mind, this notion of preventing loneliness and isolation really get us to this notion of what do people want, right? And we can think about answering this question very personally. Certainly we could answer this question by virtue of thinking about people you serve or the key recipients of support of your organization or of your division, right? All people want to be active and social. I mean, we are social animals, and although some of us are a little bit more extroverted, other people a little more introverted, but that doesn't change people that want to be active in the community. Folks want to engage and be a part of something. um, People want to be treated with dignity and respect. People want to stay, in their homes. They don't want to necessarily be placed somewhere. Folks obviously need to get around the community. We are social animals, and the things we crave are often in other places, and consequently, part of that, part of our energy is to be able to travel. And people want to be active. And all of this culminates with this last point on this PowerPoint, right? And that this all sort of comes to life through relationships, through the connections that we have with each other. And when these things don't happen, or when they're not realized, um, bad things unfold. And I'm going to get into some of what we know and some of the data here. But all these things are really fundamental, and they're what people want. We also know commensurately that if people are lonely or isolated, they have difficulty achieving those things that they want. And all of these things have some ripple effect. People begin to feel disconnected or excluded, alienated. We know that more sick days are associated with folks that are separated from networks and from people. Confidence is lessened and limited, and literally people actually die sooner when they're isolated and lonely. And I'm going to show you the data that underscores these kinds of realities. We also know that there are people at greater risk of being isolated, and this is even pre-pandemic. Certainly, with the pandemic, all of us are experiencing elements of isolation and loneliness. But literally pre-pandemic, and when this pandemic ends, and when we get our vaccines, and we get this all behind us, these groups are still going to be at risk of social isolation. elders. In fact, the American Association of Retired People, AARP, in the United States, have really made social isolation one of their cornerstone pieces because we know as people age, two things happen. One is that their social networks begin to diminish a bit. People start dying, people start moving places, things begin to interrupt their connections. We also know that chronicity of aging begins to create, challenges to connecting with people. So seniors, elders, are at great risk. Folks that are economically disadvantaged, poor folk, are at huge risk of social isolation in many ways because to connect sometimes requires money or requires some type of access to economy. And consequently, if somebody is denied those things or doesn't have access to funding, they can't really pay for things that would be realized as part of their engagement. Folks with disabilities, any of the advocates that are on this call today um, can know that the people they serve and support who are experiencing disabilities are at risk of isolation or are significantly isolated. I'm going to get a little bit into some data on this from some recent research that really has shown comparisons and contrasts between folks with disabilities and folks without disabilities as it relates to relationships and connection. Single parents, folks with mental health conditions, ethnic minorities, sexual orientation minorities, anyone, in fact, who feels different for whatever reason can be at risk of being isolated. Now, in order to really appreciate this as a baseline, here are some definitions that help us. I'm saying isolation and loneliness, and know that those two phenomena are related, but they do have some uniquenesses. They're like cousins. They're not exactly the same. Social isolation is a state where folks lack a sense of belonging. They have minimal numbers of contacts. This is very tangible, right? Loneliness can occur in the presence or absence of isolation. So someone could be very connected and yet feel or find themselves feeling lonely. I know for myself, pre-pandemic, I did a lot of traveling, trainings, and coaching and consulting. And I would, be invited to places, and I would go and I would share ideas. And then at the end of the day, I would go to some, cold, hotel room, and I would feel lonely. I missed my family, and I missed my, my connections, and so even if you're very connected, you can find yourself in the throes of loneliness. And both of these situations, isolation and loneliness, have very detrimental consequences for human beings. Social isolation is objective. It can be identified, mapped, and quantified. You can actually measure it. Whereas loneliness is very subjective. It's felt and articulated by people. And for some people, it comes and goes. For other people, it just remains constant. And so these two phenomena are different, and they're universal. We know that loneliness and isolation have been on the rise around the world in every culture. And I'll show you some data on this that's stunning. But Jean Vanier, the theologian who was very active in helping devalued people, said, "To be lonely is to feel unwanted and unloved, and therefore unlovable. Loneliness is a taste of death." This is a very, very powerful quote that really, that we all have experienced from at some time in our life, or might experience at some time of our life. And let me tell you the impact. Um, in looking at isolation and loneliness, there's been now, and especially very recently, studies that have really begun to focus in on this. This is a study that was done in in 2012, 2011, um, by some folks at Brigham Young University in the United States, and it was funded by the AARP. Although the sample of people that they looked at were broad and generic, but they followed 308,000 folks, almost 309,000, for at least 7.5 years, for some all the way up to 15 and 20 years. And they found that folks with social relationships, again, remember our next training cycle that we're going to be doing later this month on January 26th is going to look at relationships. But what they discovered is that people who have social relationships have a 50% greater likelihood of survival. I mean, this is stunning, because what it suggests is that isolation and loneliness is comparable to smoking at least 2 packs of cigarettes a day in terms of its lethality. It is as challenging as bad diet, or limiting or lacking any kind of exercise or motion. I mean, it puts it right up there with these other clinical factors that have been tied to mortality. And but not only has it had that effect, it's costly. It's costly for communities. It's costly for society. And for those of us that that are concerned about taxes, or where general funding for society goes, the impact of people living in social isolation in the United States of America is $7 billion a year to the cost added to Medicaid, mostly because of longer hospital stays. We know that when people are lonely or disconnected, they're at greater risk. Not having community supports at home, not having relationships. That's one of the tragedies of the pandemic and of the COVID situation, is people dying by themselves. And I think that increased mortality, when we look at the data and the numbers of people worldwide who have died from COVID, I've got to believe that the spike in deaths have really been affected by the contagion of COVID, and then the isolation of people from their loved ones. We know that connections with people help us thrive, and when we don't connect with people, we are at risk of dying. And I'll show you some of those data. But beyond that, some of the researchers on this data that I'm talking about here suggest that just simply living alone or in an isolated place may be just as harmful as feeling lonely. So that if you are disconnected, you find yourself by yourself day in, day out, the harm that will happen, and I'll share a little bit of what that is exacerbated and further developed, because there's a biology associated with loneliness. And that biology goes all the way back to sort of our primitive genetics, like how we were essentially constituted as animals. And because we're social beings, we need each other. And when we're separated from our tribe or our pack or whatever our social network is, our physiology begins to change. And this goes all the way back to our primitive sense. If hunters and gatherers, and they were on hunting and they got separated from their pack or their tribe, what began to happen is the inflammation, the respiration, circulation, the nervous system began to become more acute, based on being rendered by yourself, being rendered lonely or separated. And those things happen primarily to help the person get back to their tribe. So they created this greater sort of tentacles that allow the person to then navigate through the risks and the challenges of being by yourself or being isolated. Now, those things are coded in us, and that happens to any of us. However, these things help short-term survival, but over the long haul, they're incredibly detrimental to a human being. That they lead to all kinds of health-related risks. So although they're coded in us for survival, on the long term, they do great harm. And this is really an important element because the longer we let loneliness or isolation just sort of fester, the more it is lethal to those folks experiencing that. And the irony and maybe the slap in the face is that we can address all this, that it creates this loneliness and isolation create depression. They suppress the person. They diminish some of those really important enzymes that we use in connection and that we use to feel loved and feel important. So serotonin and oxytocin and other kinds of enzymes that are just woven into our social fabric are diminished by loneliness and isolation. It increases mortality. And so isolated people that are disconnected, have disrupted sleep patterns, altered immune systems, higher stress hormones, increased heart disease and stroke, and it accounts for 30% higher risk of dying within a 7-year window. This is lethal stuff, ladies and gentlemen, and it's not a disability issue. This is a society issue. This is a community issue that all of us can play an important part in addressing. And so there are clearly, clearly things we can do. But know this, even pre-pandemic, that social isolation and loneliness are on the rise. The pandemic has just exacerbated it and put it in every one of our faces, every one of our faces. But the New York Times in a recent editorial talked about the fact that loneliness has doubled from 20% to 40% in the United States of America. And what we're discovering is that in other communities and cultures all over the world, I've lectured on this or shared with colleagues in Australia and New Zealand and Scandinavia, UK, Ireland, really all over the world, we're seeing this kind of an increase. And let me tell you just a recent study that was done that really corroborates and further acknowledges the lethality and the prominence of loneliness and isolation. In 2018, Cigna Insurance Company launched the study, and they used the UCLA loneliness scale as the core instrument. Now, I sent you, Tanya actually sent you the loneliness scale. And UCLA, University of California at Los Angeles, back in the mid 60s, developed a scale. The scale has 20 items. You have a copy of the scale. The scale's in the public domain. So, you can Google it. If you didn't get your copy, you can Google it. You can find it, on the internet. But there are 20 items on this loneliness scale. And each of the items ask a question and then ask you to respond in one of 4 ways, right? And they use a Likert, folks that are familiar with, social science research know that Likert scales are used a lot. And Likert scales give you sort of a range. Never,
Al, can you go back
rarely.
one slide?
Pardon me?
Al, can you go back one slide?
Yep. Okay. And what this is the results of the Cygnus study. And I'm gonna jump back to this slide in just a minute, but let me talk a little bit about this loneliness scale so folks understand this data. I'll go back to the data in just a second. That these 20 questions that you have ask, and I put 3 up on this slide, right? Just to give an example. So they ask a question: how often do you feel that you lack companionship? Right? And you would answer 1, never; 2, rarely; 3, sometimes; 4, often. Right? So you got 4 options, and each of those options have a value. 1 for never, 2 for rarely, 3 for sometimes, 4 for often. And then at the end of the 20 questions, you add up the answers, and the lowest score you can get is a 20. That is, you would say never to every question. The highest you can get is an 80. That would be, you'd say often to every question. There would be 80 points. You would just tally, 4 per question. Now, the score of 43, after UCLA has tested this for validity and reliability, and they've done it with all kinds of different groups, have verified the efficacy of this scale, right? And so back to these data. Cigna Insurance Company, which is a very large insurance company in the United States, recognizing this very potent reality of social isolation and loneliness, did the UCLA loneliness scale with 30,000 Americans. They did this just in the United States. And they did it all over the country, and they did it for all different age groups. So they, from a generational point of view, they wanted to see if there was some differences. They wanted to see how people responded. They did it through a telephone survey, right? And then they codified all the information. And here's what they found. Nearly half of Americans reported sometimes or always feeling alone or left out. Now remember, 43 is the tipping point in terms of numbers. And so these data begin to show that a lot of this is really pushing into this pretty significant loneliness area, right? But some really fascinating things on this study was that they found that the loneliest generation were the youngest generation, Generation Z, kids 18 to 22 who have, computers like this in their pockets that can connect, instantly with their friends, found themselves to really, when they answered the questions, to be really feel the loneliness, the loneliest. Now, this is really kind of face slapping. This was done obviously pre-pandemic. I would think that if we would do the loneliness scale today, we would and we would find, that literally, these numbers have gone up. I would ask you to do the loneliness scale, the one that we don't do it now, but when you have a minute, go through this scale, read the questions, answer them as honestly as you can. Don't try to, guess what the question is going to be leading to, because know this: the questions on this scale, right? Never, rarely, sometimes, and often. On some of the questions, get reverse scored. So and that's all on the thing that Tanya sent you. So do the scale and then tally it up and see where you lie. I know in our project, the project that we're launching at Community Living Algoma, we're going to do the loneliness scale with folks we support. And we're going to use that as a baseline so that when we begin to roll out some interventions, some things that we're going to do differently for a test group in our project, we're going to be able to come back to the loneliness scale and see if, in fact, there's been some empirical impact in the work that we've done. And so the late comic Robin Williams said, "I used to think that the worst thing in life was to end up alone. It's not. The worst thing in life is to end up with people who make you feel alone." This is really just a powerful reflection, because it it suggests that even if you have people around you, that doesn't necessarily change your isolation or change your feelings of loneliness. Just the mere presence of people in your life is not enough. This has to be that we have to look at this in a much more focused kind of a way. Now, we know as we go into this that the way to address loneliness is to get people more engaged, right? To get more active, to get more involved. Yet we know through research that there are reasons why those groups that are at risk engage less. We know. In fact, let me just quickly tell you, we did a study in Pittsburgh through Chatham University, one of our schools here in Pittsburgh. And we looked at 50 families. 25 of those families had children with disability labels. Their children had IEPs in school. They had a bona fide diagnosis: autism spectrum, cerebral palsy, intellectual disability, some official diagnoses. The other 25 families had children very similar in age, demographically and gender-wise, but they didn't have a disability label. Their children were not diagnosed. They didn't have IEPs, right? And with those 50 families, we did a survey called the Social Capital Benchmarking Survey. I'm going to talk a little bit more about this next session, the next session that we have on relationships, because the Social Capital Benchmarking Survey was developed at Harvard University in the early 2000s. It was developed by Robert Putnam, one of the top sociological researchers on social capital. And what Putnam wanted to achieve by creating the Social Capital Benchmarking Survey was a baseline to engagement, a measuring of how engaged are people. Now, obviously, Putnam wasn't interested in a specific way on vulnerable groups. He was really just interested in generally discovering what is typical for engagement for typical person. And so they did a study in 2006 called the Saguaro Seminar Series. Harvard did this. And they looked at 20,000 Americans. They did the Social Capital Benchmarking Survey. The survey has 60 questions, and it renders, responses, percentages of people who answer questions in certain ways, and it gives you a sense. He did this around the United States, so he wanted to get a sense of what is typical community engagement patterns for people in the United States. So using that very same survey, what we did was we cut it back a little bit to 40 items just to make it a little bit more digestible, but we didn't change any of the intentionality or any of the wording. And we surveyed these 50 families to see how engaged they are, where they go and who they go with, and do they know their neighbors? Are they out and about? All these different levels of measuring engagement. And as you might imagine, the families who had children with disabilities, the 25 families, engaged far less than the families who had children without IEPs, without disability labels. That was predictable. We thought that would happen. But what we were really more interested in is why, right? So we did a qualitative analysis follow-up with these 25 families who reported much less engagement. And we said, why? Why are you engaging less? What are the reasons? And this list shows you what we discovered. We discovered that people didn't engage because they couldn't afford it. We discovered that people didn't engage because it was logistically challenging. They had to figure out, where would they park, and was it accessible, and what happens if their child has a meltdown, right? Um, they didn't engage because they were so busy with medical appointments, therapies, and things that they had to do based on the disability. They didn't engage because they felt unwelcomed. They didn't feel welcomed by people. They didn't engage as much because other people seemed to fear them. Other people backed away. Other people didn't want to be around them. They didn't engage as much because they were embarrassed. They were embarrassed. I know all of these 6 things all too well, very personally. Is when we were supporting our dad. My dad had Parkinson's, and as we supported our dad, especially through the last 7 years of his life, we wanted to keep him engaged in church and in community and in activities. But every time we tried to get him out there, one of these bad things reared its ugly head and made it hard for us on every level. So we know that some of these things are, antecedent to people not engaging that much, both individually as well as families, right? So how do we address this challenge of loneliness and isolation? What can we do about it? How do we come to intervene, right? So the very first thing is that we need to re-examine the roots of this problem. What causes loneliness and isolation? We think that it's because of the person. Maybe the person, individually. We call that micro, right? Maybe we ought to change that person a bit. Maybe if we could do something with that person, they would engage more, right? But we also have to understand that there's a macro side to this challenge. Maybe we need to think about how the community receives people, its willingness to engage, right? So this notion really of micro and macro really leads us to thinking about these approaches, right? Because they're different, they're very different, and they require very different interventions, right? Micro change is really about changing the individual, helping them do something different that will help them connect the community, right? Macro change is really softening the environment, the community, doing something that really impacts culture and community, right? So now each of these have some efficacious things for us to consider in terms of intervening, right? On the micro side, obviously we're thinking more clinically about people, and folks do have realities in their life that get in the way. There's no question about that. My cousin Carrie, for example, had a significant speech impediment caused by a cleft palate, right? Now that when she would talk with somebody, they just didn't understand what she said, right? And so in some ways, if we wanted to enhance, or if we want to enhance Carrie's engagement, maybe we think about, can we help Carrie speak a little better, right? Now that's a micro intervention that really looks at doing something with Carrie. And in terms of addressing social isolation and loneliness, there are micro interventions we can consider, right? And in our project, in our community engagement project at Community Living Algoma, we're going to look at some of these strategies and ways that we at Community Living Algoma can in fact do some of this, right? Now, not all of these things are going to work for everybody, and some of them might be off the table, others might be very realistic, but I think we need to think a little bit about what some of those micro aspects are, right? Cognitive behavioral therapy, social prescriptions, social fitness exercises, cultural profiles, which sort of identify some things. In fact, next month, we're going to go over cultural profiles when we talk about the building of relationships. Mindfulness, just being conscious of of your situation. Ice breaking practices. How do you get a conversation started? All of those things are micro interventions, and again, these some of these things will be efficacious. But we really feel the uniqueness of our project at Community Living Algoma is the focus on the macro, right? And to think about the environment and things around the person. Give an example. My cousin Carrie had difficulty speaking, right, because of her cleft palate, and um, and was hard to understand, right? So speech therapy was recommended as another way of modifying and assisting Carrie to engage more. The interesting notion was that in our family, on our hill, on our family hill, Condeluci Hill, um, we all understood everything Carrie said. Right? She didn't have to go through speech therapy to communicate with us because we understood her. And now, how did we understand her? And folks in the greater community didn't, right? Um, that was because we had a reason to listen. We loved Carrie. We cared about her. She was part of our tribe, right? So macro change is really how do we impact the greater community, right? Now, there are macro interventions that we're going to look at in this training series over these next couple sessions that we do, and that we're going to intentionally, um, utilize in the Community Living Algoma Community Engagement Project, right? Community mapping, knowing what's out there is really one of the first. Utilizing some of those low-hanging fruits of things that are out there primarily for community centers, libraries, other kinds of community setting. Understanding gatekeepers. Who are the people that might open the gates in these community resources and welcome in someone who has been, on the peripheral or adjunct to the greater community? Who are the people that can welcome folks in? Softening the cultural infrastructure in just a general way, so that the community is more, compassionate, maybe less mean spirited, is another way of saying that, because some communities are very, very blinded, and we just want this group of people and no one else. It's a gated community. That kind of, those kinds of things have happened in our cultures. um Things like community benches and coffee connections, and these are ideas we're gonna explore a lot of these in our last session, but I want to just say a word about some of the approaches that have been taken by other societies. Last idea here is a world cafe. A world cafe is an opportunity for community members to talk about welcoming and hospitality, and how we create a community where everybody belongs. That can happen in a conversation in a world cafe. But let me tell you about the United Kingdom, um, and some of the things that they've been doing that I think are really inspiring and exciting. Because in 2018, just a couple years ago, um, the United Kingdom Parliament in the United Kingdom launched a commission to study loneliness and isolation in the UK, not for people with disabilities or not for elders or not for a specific group, but just generically. And what they wanted to do is understand, was isolation and loneliness a problem in the UK? If so, how do we address it? Right. And after this commission studied for an entire year, studied loneliness and isolation, they did surveys and interviews, and there was a whole variety of methodology that they used to study it. They ended up Parliament decided that they needed to really officially address this. And so they created a ministerial office to address loneliness. And this ministerial office was, in fact, specifically challenged to do three things. One was to reduce the stigma associated with loneliness. What they discovered in the commission study was that people wouldn't admit that they're lonely. They didn't want to talk about it, because if they did, people would think that they were losers, or people would think that they were, stupid or inept, or whatever other kinds of, label might be given to someone who talks about their loneliness. They wanted to reduce loneliness through a national agenda, a national macro agenda. How do we change the UK? How do they soften the infrastructure of the United Kingdom? And then provide evidence and data to baseline where's the country now, and then to intervene, and then see where is the country after these intervention strategies unfold. Right? And so they began to do a number of things. Some of them I mentioned earlier, social prescriptions. They started to look at, how do we get people on the community car services, ways of transporting people, developing social hubs, intentionally reimagining space in a way that would make that space more welcoming to everyone, right? Literally statistically following all of this, right? So something like Community Bench. Let me give this example. I mentioned that in the laundry list. What they did in the UK is they rolled that first in some of the larger cities, and then their whole agenda is to develop this throughout the UK. But what they did was a study at Hyde Park and some of the other major parks in London, and they looked at patterns of people in the parks, where they sat, who sat with whom, people that sat by themselves. And then what they did was they put a little inscription on the park benches throughout Hyde Park and the other major parks in London. And the inscription said, if you're sitting at this bench, please feel free to say hello to the person that you're sharing the bench with. Just to give permission to engage. Now, with something like that, I don't know, will that eradicate loneliness? No, of course it won't. But that is one step in the right direction of softening a culture, of a macro agenda, right? And so human conversation is the most ancient and easiest way to cultivate conditions for change, right? This is about people conversing in softer ways, and on park benches, conversing in world cafes, conversing with each other about creating places and spaces that people feel welcomed. Right? So it's not our differences that divide us, and we oftentimes think that that's what it is, but it's our judgments about those differences that really divide us. And so the antidote to all of this is social capital, which is going to be the topic of our next training coming up on January 26th. That's a Tuesday at 10 o'clock. And we know that social capital is the value we get from our relationships. We know that social capital promotes ethics and compassion and pro-social behaviors. We know that social capital is at the core of people being healthier and happier. We know that social capital actually allows people to live longer. That life expectancy studies, longevity studies all around the world have focused in on the key ingredient to a longer life. And that key ingredient is not just a good diet, getting rest, stop smoking, exercise more. It's building relationships and maintaining relationships and sustaining relationships. And so Putnam, Robert Putnam, who I mentioned before in the Social Capital Benchmarking Survey, said in his landmark book called Bowling Alone that he wrote in the year 2000, that if you belong to no community and decide to join one, you cut your risk of dying in half over the next year, in half. Okay? And what Putnam says and what data shows is that relationships breed life, and loneliness and isolation breed death. So the building of community, there are some steps and stages. Next session, we're going to explore these steps in a little bit more of a focused way. We're gonna kind of frame them a bit more and talk about them a bit more. But we know that there are some processes about relationship building, which is at the core of addressing loneliness and isolation. So we'll look at those next session. And we're going to look in session 3 and session 4 really more clearly at finding gatekeepers and people in everyday community who literally can model and influence other people in terms of how they behave. So we'll look at this concept in our third session, which we do in early February. We're actually going to play around with. We're going to tinker with understanding gatekeepers. We're going to actually do an exercise. Are we potentially positive gatekeepers? We'll do a little exercise about that will focus in on that. Because we know we find ourselves right now in a pandemic. And we know that pandemic, maybe the silver lining of that pandemic is that it slapped every one of us in the face in terms of recognizing the ill effects of loneliness and isolation. And that literally any one of us are at risk of some of the negative things that can come with loneliness and isolation. And in terms of addressing this in a pandemic, back in April, I was when the pandemic, March was when the pandemic actually first was identified and rolled out, and then all the elements that happened. And I was scheduled to do a large keynote at a large international conference here in the United States, sponsored by a group called ANCOR, which is a national rehabilitation group. And I was going, they invited me to speak about social capital. This was even, we had scheduled to do this back in 2019, in the mid 2019, and before we even had any inkling of a pandemic. And obviously, the conference was canceled, and so they said, let's try to make something positive out of this by actually taking a look at how do we get people connected while we're in a pandemic, right? So through ANCOR, I did a survey, a study with 80 different agencies in the United States and in Canada. and just culling from them, what are they doing? What do they think we should do? What could we do? And so here you see a list of some of the things that folks said, these agencies said. You're aware of all of these things because in fact, we've been living with this for the last 9 months, 10 months. And, but these are just some of those, things, actions, activities, interventions, if you will, that organizations that support vulnerable people have been doing to try to lessen the throes. And I'm sure every organization that's on this call today has done some variation of these things or are doing some variation of these things. But, at the end of all of this, we know that this pandemic will end, right? We have a vaccine. It's 95% effective. There's a plan to roll this vaccine out worldwide. Some of those things have bumps and they're not going as fast as we would like, or perhaps as viable as we would like. But we know that the cavalry is coming, right? And that by best predictions are by the summer, and early fall, hopefully this will be behind us, and this pandemic will really be a part of history. Um, and and so once that pandemic is over, what are we going to do? What can we do? What might we do to address loneliness and isolation? Because those things are still going to be there when the pandemic ends. And so Sir Francis Drake said, there must be a beginning to any great matter, but continuing till the end, until it be thoroughly finished, really yields the true glory. And when I started this session, I mentioned that from in my 50 years as a professional advocate, we've been on this voyage from the very beginning of my career, and even before then with my cousin Carrie growing up. We wanted Carrie to be engaged, involved, active in community. That's what we wanted for her. And when I entered the field, that's what I was hired to do for the agency. So there's been a beginning to this matter. We think about all the things that have happened in the beginning, right? The deinstitutionalization movement, getting people back into community, and liberating people. All of that was in the very beginning stages of this voyage. However, we know that we've only come so far, and if we really want to finish the job, that really requires us to think about macro strategies. So let me end with this, and then we'll open this up to some question and some dialogue. Um, our webinar is really slated to go till noon. We'll engage questions, as long as you have them or want to. If we end a little sooner, that's great. If we go until noon, that's great as well. But let me end with this little parable. It's a wonderful little parable that I found in a book called "Conversations Can Change the World" by Margaret Wheatley. Margaret Wheatley, really one of the really strong thinkers about full and inclusive community. And this parable it goes like this. A long time ago, there was a great fire in the forests that covered our earth. People and animals started to run, trying to escape from that fire. Our brother Al Tecatl was running away also when he noticed a small bird hurrying back and forth between the nearest river and the fire. He headed toward this small bird. He noticed that it was our brother, the Quetzal bird, running to the river, picking up small drops of water in his beak, and then returning to the fire and dropping that tiny bit of water on the flame. The owl approached the Quetzal bird and he yelled at him, "What are you doing, brother? Are you crazy? You're not going to achieve anything by doing this. You got to run for your life. You got to take care of yourself." The Quetzal bird stopped for a moment. He looked at the owl and he answered, "I'm doing the best I can with what I have to save a place that I love." It's remembered by our grandparents that a long time ago, the forests that covered the earth were saved from a great fire by a small little quetzal bird and an owl and many other animals and people who got together to put out the flame. Right? I love this little parable because I think social isolation and loneliness are a great fire, and that all of us can play a role in addressing that. That there are people who are at risk of perishing in this fire, and then until we um, begin as a society, as a culture, as a community, begin to really look at ways and means for people to engage and for people to take their rightful place in our community, we will continue to fail. Right? And clearly, we must become the change we hope to create. And again, not just with one specific group of people, although certainly any energy is welcome there, but for us as a society, as the Algoma region, as any of our community, Elliott Lake, Blind River, any Wawa, any of our communities, for us to think about ways that we can create entree, that we can create a community where each belongs. And so let me just give you some contact information for me. And I put this up there mostly because if we don't get to some questions that you might have, or maybe after you digest some of this content, and I apologize, we've gone through a lot of stuff, you might have a question. And this is the way of getting in touch with me. You can email me. There's my email address. You could call me. There's my phone number. And there's my website, alcondeluci.com. I put that up there primarily because on the website, I have some videos that address this, short little training videos that you could use with your staff um, that look at social isolation, look at loneliness. I have a TED talk I did in 2014 in Pittsburgh that focused in on social capital. So if you're inclined to use TED Talks to think about things, you might want to take a look at that talk. I have some articles and white papers, chapters from my book. I have a link to my publisher, so if you're interested in maybe getting a hold of some of the stuff that I've written, you're invited to do that. So this information is also on the materials that Tanya has sent you. And know that we have 4 other sessions of content that's going to really allow us to begin to examine micro. This is going to examine both micro and macro intervention strategies. We're going to really focus our attention on things we can do, and then hopefully roll up our sleeves and do it. We'll talk a bit more as we're going through these training sessions about our project and our intentionality of really not only reworking both micro and macro interventions for individuals, but chronicling what we're doing. We have Cindy Crawford has joined our effort to help us, with press releases and information. As we develop this, we're looking at perhaps maybe writing a manual that we can, make available to our brother and sister organizations really around the world about ways of addressing these issues. But today was to kick it off by having us all really become sensitive to this challenge of isolation and loneliness. So what I'm going to do now is I'm going to stop sharing my screen, kind of bring us back to our gallery, and then what we're going to do is Tanya and Corey are going to kind of go through any information that maybe came out in the chat rooms that folks have, and then any live questions that folks might be a part of. I know we have 87 people participating in this gathering from really from all different parts and all different walks of community. And so that is really, really encouraging that this many people have really showed, an interest in wanting to address this challenge that we outlined today. So let me stop sharing this screen. So let me kind of go back to a gallery, and then let me, ask Tanya and Corey if there's any questions that came up in the chat room, or any issues that people raised. It doesn't have to be a question. It can be a comment, or it can be, a thought that you had about this and how it might have an impact on you. Okay. So Tanya, Corey, was there anything that came up in the chat room? I see that there
Hi,
were,
Al.
yeah,
Tanya lost connection, so we'll wait for her to come back in. But there is a question in the chat room. There's a couple here. So the first one is curious about the early warning system. How long until it comes into effect?
yeah, yeah. That's really an excellent question. And the stuff that I've read, the research that I've done on the physiology of loneliness and isolation, is that the minute the person begins to sense that they're vulnerable, these things kick in. And that, I mean, any one of us can think about this. I know I mentioned that I travel a lot, right? Pre-pandemic, I was, gone a couple times during the month, someplace or another. And I know that sometimes I would find myself in a new city, a strange place that I'm not familiar with. And, I would maybe be coming back to my hotel from dinner. And I'm by myself, and I'm maybe walking, and initially recognizing, it's dark, here I am by myself, I'm in a place that I don't know, and I could almost feel those physiological things like the acute nerve endings, my heartbeat beating a little bit more, circulation, maybe nervousness, all being generated by that feeling of vulnerability, that maybe something might happen to me that would be bad. So and those things, it would be interesting. I mean, I'm a pretty confident person, and I'm, I mean, I grew up in a blue collar town. I can take care of myself, I think. Um, but when I find myself in those kinds of situations, those alert systems kick in. And I'm sure everybody on this call has experienced something like that somewhere, somehow, some way in your life. No matter how connected you are and how engaged and involved you are, when you're by yourself, the signals of vulnerability begin to kick in, and so I think that I think, I don't know if that totally answers the question, but I know for me it's been the personal experiences that I've had when I found myself in situations that maybe I wasn't in control of. Great
Thanks, Al.
question.
There's a second part to that question. So they're asking how long until you can recover from early warning system once you have proper stimulus in place?
Yeah, yeah, and that's the second piece of the puzzle. That I think that the minute you find yourself in safety, again, whatever that safety might be, being around other people, being in a place where you have more control. When I get back to my hotel room, or whatever that might be, then those alert signals that cause your heart to beat, your respiration a little bit higher, your nerve endings, that begins to then start to sedate, and and end when you're in a place of safety. And that's really in the end, that question and that point is such a good one, because that's what other people in most cases do for us. Now, there could be a situation where, you know, you're among a lot of people and you really feel even more threatened. I mean, if you look at what happened in the United States Capitol last week, with that mob, you know, ascending on the Capitol, the United States Capitol. You know, there's lots of people there, but man, oh man, the vulnerability was so. So it's not just people that make you feel safe; it's the context in which you're with people that make you feel safe. So I think that that the nervousness and you know, the rapid heartbeat and and those kinds of things. I mean, it's in some ways why you see people, you know, having heart attacks in vulnerable situations, is that literally that that piece, which is really designed to try to prepare you to deal with something, can go over the top.
Al, the next question in the chat, and then I think Tanya will go to some hands.
Okay.
While we try to calculate the loss we've experienced since COVID started, the only thing I can see as an opportunity so far is the possibility of empathy that can come from such a collectively profound experience.
Yeah. Well, that's really a lucid point, because in some ways we've all become more empathic about loneliness and isolation through the pandemic. Now, how long that will carry over into changing somebody's heart and their actions after the pandemic ends remains to be seen. Let me use this example. Robert Putnam, the Harvard sociologist that I referenced during the talk, wrote a book in 2000. The book was called, you know, Bowling Alone, and it was an expose on social capital and what social capital can do, and how it did, you know, banding together of people and the really positive things that can happen. And shortly after that book came out, 9/11 unfolded, and in 2001. And Putnam, you know, was at that point very, very involved in looking at um, communities coming together and, you know, doing things positive for each other, and being more compassionate. And what he began to do is, after 9/11, he sort of followed the incredible generosity that unfolded, not just, you know, in people in the United States, but around the world. You know, the generousness that negative thing engendered in people, right? And so what he saw statistically, as he tried to measure some of this, he saw this spike in in people watching that and the welfare that people had for each other. And then shortly thereafter, that spike of connectedness and watching out for each other began to diminish. And so, although 9/11 and the effects of 9/11 created this energy, this positive energy to watch out for each other and to give blood and to, you know, do things that were behave in ways that were pro-social, that began to diminish shortly after 9/11. And people went back to, you know, their selfishness and their, you know, their little islands, and so, you know, that going through the pandemic, all of us who have gone through it know what it feels like to be restricted and to not be able to be out there with people we want to be with, and and so I think there's going to be a spike in community compassion, but I don't know how, you know, I think once the pandemic's over and people are not sick anymore, and we go back to our daily routines. I think that compassion level will start to decline. So softening community requires, I think, constant tending. That we've got to think about it, and we've got to keep it in our minds, because there's so many other distractions that it's going to be very easy to just kind of go about our business and take care of our own butt and not worry about someone else. There's a really interesting debate here between altruism and individuality, right? Between recognizing your community responsibility and taking care of your own butt, that individuality. And that debate is really an interesting one to think about and look at. Taking care of yourself versus taking care of others. Making sure you're safe or helping other people become more safe. And I think life is sort of a constant, back and forth of these two things. I mean, there is clearly, the whole notion of selfishness and individuality. That there's a piece of that, but in all of us, in every one of us, but that um, communality of experience is also, I think, within each of us, and I think just being sensitive to that, just being alert to it. That's why something like a World Cafe, which really get people to think about these things, is really such a cool um, intervention. Because if you can get people to really think a little bit about their own lives, and then their neighbors' lives, that we begin to awaken, I think, a real sense of, am I my brother's keeper, or do I just have to make sure I'm safe? And so it's just an interesting conversation. Other questions that came up.
Louisa's next.
Hi, Al. There was a slide that you showed, and I think it was from the Harvard study about loneliness, and I was really surprised about this, but I kind of want your feedback on this. It said that bracket between 18 to 20 or 21 are the most lonely. And I thought about that for a while, and I thought, is this because of the new forms of communication? Is it the social media piece? Is it that kind of stuff that's creating the lack of that interaction? What are your thoughts?
Yeah, Louisa, what a great awareness that you had about that. When that was reported in the Cigna study, the researchers were just really amazed at that. They were, it was so, it goes against the grain of almost conventional wisdom. You would think that the youngest generation, who have grown up with cell phones and texting and Snapchat and these other kinds of media platforms, that you would think that they would feel the most connected, and yet they, at least according to the research, were the least connected. Now the researchers went on to say that they couldn't put their finger on the fact that this was because of social media. That they didn't have enough evidence of that. But I gotta think that there is a piece of that somewhere in that dimension. And had they been looking at that intentionally in their study, I think they might have discovered some things. Because any of us who are raising children of that age, or have a direct connection there, you can see that these guys are affected, I think, so much more by the impact of social media. Like for example, I just this morning, as I was getting prepared for this session, I had TV on, and there was this researcher who was talking about a new phenomena called Zoom dystopia, right? And I'd never heard, so I paid a little attention to her point. And what she was saying was that Zoom, which is now a platform we all have been using so regularly, have become aware of how we look when we talk, right? And that when we're on Zoom, and those little, cells of people, and we see ourselves talking, that it causes us to become critical of ourselves. Now, this researcher who was on talking about Zoom dystopia this morning said that this has really been something that younger, kids, teenagers, young adults have, because of the heightened awareness of appearance. And they have the platforms where you can change your appearance, and you can soften the light or broaden the light, or take the bags out from under your eyes, or whatever we end up doing. And I think the older you get, obviously the less that really matters, the more superficial that seems, I think. But the younger you are, the more vulnerable you are to that. I mean, we know suicide rates are up for younger, cohorts, and so I think that there's some of that gets meshed in here. Although the researchers in the Cigna study, really didn't probe. All they were doing was sort of looking at where people measured, and they discovered that the kids, the Generation Z, measured so much greater. Like when you take the loneliness scale, and again, I would recommend that folks try this. You score yourself, and then you'll have a total, right? And when I did it, my total was 28, right? Now 43 is the cutoff, right? When these kids did it, their total was above 43 or 48% or whatever. So it makes you begin to really wonder, what's going on there. So I've got to, if I would speculate as a sociologist, it would be that they that there's these other kinds of elements of when you're on FaceTime, and you see yourself in that little corner as you're talking to people, you see that, and it makes you feel, well, I'm not as pretty as I could be or should be, or I'm not as handsome as I thought. I think some of that kind of gets in there, and that's why people don't like me that much, and that's why I feel less loved, or less less viable as a person. I don't know. Interesting stuff. Great question, though.
Thank you.
Al, the next comment comes from the chat. So I think it's brought to light the advantages of having to redefine service delivery, being able to connect people via Zoom, but also the challenges. Oh, sorry, the chat jumped here. Also the challenges for people being able to connect without technology. So many people cannot afford internet or a device to connect with, which makes service delivery very hard right now.
Yeah. There's no question that that internet and virtual reality is the next best thing for us, being isolated or being distanced from people, and that using something like Zoom provides a platform. Now, the one thing about Zoom that is the negative thing, in my opinion, is that it is the intentionality and the technology needed to launch Zoom is a little bit contrived. It's not as it's not as spontaneous as seeing somebody on the street and chatting with them, talking with them, bumping into somebody at a party or a gathering, and catching up. And so for me, I don't think Zoom ought to, I think when we get out of this pandemic, I think Zoom, we could still do Zoom things, but I think, really being intentional about getting people out face to face directly becomes really important. And the worry that I have is that because a lot of DSPs, direct support professionals, they're very comfortable with Zoom, that after the pandemic ends, we're going to see a pushback on, well, why can't we just use Zoom? It's easier. We don't have to get into the van. It does. You don't have to get somebody dressed. You don't have to deal with all the logisticals, all that stuff I put in that one slide: logistics, economy. All those things that can be deterrents to engagement are, and because we have Zoom, now we're going to say, well, we don't have to do it. Let's just do it through Zoom. Let's just try that. And I think DSPs, being younger, they're probably they're very comfortable with Zoom, and so I think the elements are all in place for us to begin to keep people physically isolated by using virtual connections. And I think we really got to think about that. That I think that's a real risk. And so some things loom out there for us as we get this pandemic hopefully in the rearview mirror, and really try to begin to come back to some actions that are typical to engagement, where people really feel satisfied in the engagement. There's some satisfaction lost in meeting with people through Zoom, at least for me. I don't know if other people on this call feel the same way, but so I think that remains to be seen as we move through this pandemic.
Al, the next is John has a question.
Thanks, Tanya. Not so much a question, Al, but thank you again for such a powerful and informative presentation this morning. My second point, a warm welcome and appreciation and thank you to the 88 participants this morning. I know that in 2 hours or less, that we've learned something in such a short period of time to help us move forward. What I wanted to raise was that as we move on this journey of community engagement, let's not forget a major population out there, or a group of people referred to as seniors in our long-term care facilities. It was such a great article yesterday in the Toronto Star, written by a gentleman who I believe is a Canadian psychologist, but had some involvement in the world of developmental services. And I just want to read a couple things that he mentioned that I think certainly follow suit with a lot of what you talked about today. But he talked about, there's going to be a lot of resistance to moving from what is seen as long-term care institutions to something else. And he says the change of status quo requires a reimagined vision, transforming long-term care into networks of caring. And I think that's such a powerful expression.
Yeah.
He talked about the first thing is to focus on the individual. The second thing is to emphasize flexible resources tailored for that person. The third thing is to help individuals and small groups to develop supports for their long-term care needs from where they already live. So why can't people be at home and be supported from home? And then the fourth is that if we had to settle for something, that smaller settings and people being dispersed in those smaller settings is far more effective than what we're seeing today. So I just wanted to raise that, I think you emphasized that point over and over today, that this applies to all people. It doesn't just apply to people with developmental disabilities. And my challenge for the 88 participants is to make sure that whether we're in Sault Ste. Marie, Hornpain, Wawa, Elliott Lake, Blind River, or further throughout Ontario and participating on today's call, that we take that challenge back to our communities and not forget the impact that COVID and loneliness and isolation is having on seniors.
John, so well stated. There's no question that that again, these groups who are vulnerable, and again, if you put seniors in a group, there's huge vulnerability, and there's a similarity in any one of these groups. There's a similarity of disconnection that I think we have to remain sensitive to, and it gets, again, I think it goes back to thinking about community. Again, I know on the call today we have community leaders on this call who really represent either government or city municipalities or the like, and I think those broader systems of community have to, when they awaken to this, have really got to become partners with those organizations that have an agenda to address elders or folks with disabilities, or folks in poverty, whatever that specific group that organizations represent. That there has to be a real partnership with community and with community leaders. And therein, I think, when we begin to connect those dots, that really exciting possibilities begin to unfold. And it's, we're not going to solve this, tomorrow, and we're not going to solve it for everyone. There's still going to be people left behind. There's still going to be people who find themselves in lonely situations, and we need to, I think, be intelligent enough to what can we do systemically to begin to impact as many people as possible, and then not forget about some of those other folks that are really vulnerable that we have to get to. So it's a formidable task, but I think that article from the Toronto Star, I made a note of. I'm gonna pull that up online. Sounds like a really thoughtful exploration of some ideas as it relates to long-term care challenges.
Al, the next three comments come from the chat. This one goes back to your conversation on the younger generation. So that age group is also a time for transition from high school to post-secondary, and from post-secondary to the working world. And it can be really difficult to navigate these changes, and we have to make new connections during this time and try to stay connected to our previous communities. It's very easy to forget our hobbies during this time.
Yeah, really, I think a really good comment. And the only thing that I could add to it would be, I think there's differences between building a relationship, sustaining an existing relationship, maintaining connectedness with people, and they're all tied together. They're similar, but there's uniquenesses in each of those. And if you think about your own life, if we all think about our own lives, and we think about friends that we've lost, and how did we lose those friends? In the United States, there's obviously just huge angst that we're in right now, and I see on social media people saying, if you're a Trump supporter, defriend me right now, because I'm, I don't want to talk with you. I don't want to, there's this polarization happening. And if you think about what caused any relationship in your life to start to polarize, like what was it? Was it belief differences? Was it distance, physical distance? Was it a loss of regularity? Was it, just growing apart. That what I started to like or want, you really didn't like or want that, or you devalued that, or what, and what causes us to maintain relationships with people that we have differences of opinion with. What is it that sustains a relationship? So those are finer points, obviously, but they're a part of this because, relationships, if you think about your own life, they come, they go, right? Some relationships maintain over many, many years. Other relationships sort of flare out, they for whatever reason, they end. And again, if we could get our hands around some of those things that allow us and help us to maintain relationships, I think that can create some kind of a continuity, right? And therein also, I think, is really part of the challenge here. You think about how many, just some average community, player, member, who's not aligned, as a stakeholder in a disability organization or an elder care organization or whatever the case might be. You know, how many people do they have in their lives who are from a different tribe? And that, but they're still friends, even though they're not from the same tribe. And what is it that allows people to cross over those bridges between tribes, right? And when do our tribes begin to vilify other groups? And how often does that happen? I think these are all subcomponent parts of sort of thinking about that whole relationship thing. I know next session we have, which is for January 26th, we're going to cut deeper into this relationship phenomena. We're going to look at it a little bit more. What are the ingredients here? And then each of us need to explore that a bit in terms of how do we manifest them.
Al, the next comment is, I just want to take a moment to thank Al for bringing his academic weight to bear on this conversation. It is easy to think things or to see things, but to have the evidence behind a conversation may not be sensational or trendy, but it is very gratifying to know that you're on track rather than assuming. So I am deeply grateful for his hard work.
Thank you. Thanks. I appreciate that. It's something I'm passionate about and have been for many years. And what with my own awakening in my voyage, and that awakening really happened more from an academic perspective. It was when I was working on my doctorate that I think I really started to. I mean, I always have been a community sort of cheerleader. Community has always been important to me, but it wasn't until really, I was challenged a bit more academically about the community side of the equation that really got me passionate about it. And now it's fun. It's easy. I really enjoy. I just pull out here. I had my birthday back in December, and so my wife said, she took me to the bookstore and she said, you can get whatever books you want. And so I was running around buying books like this, that have been for me really incredibly, getting me back to thinking more empirically about some of this, and then trying to figure out how we can take that empirical information and then apply it, right? Which is really, I think, the exciting part of this. But I really appreciate the person who made the comment, because I think you gotta, any action has to be grounded in theory and it has to be empirically based before the action can really, I think, be successful. So I think those two component parts are real, the thinking and then the doing piece of this.
Al, we have one more comment and then one more hand in keeping with time. So this last comment in the chat is, for me, what I've personally witnessed is seniors with or without technology and truly understanding how it works. not seeing or realizing that they are lonely, but as you sit with them and use your technology to connect them with their loved ones with Face and Zoom time, it really hits home.
Yeah, that, it's almost like, a report I saw this morning. I was watching CNN and I saw this report about, the COVID deaths that are unfolding. And the reporter was talking about a family who lost 3 members of their family through COVID, and they couldn't even be there with them. They couldn't hold a hand or look in someone's eyes or embrace someone. And the reporter lost it. She just, that was so emotional, that, that tragedy of dying by yourself with people in blue gowns, and monitors going off. And, I mean, that her sensitivity to that was really powerful. I find myself crying as she was trying to report this. And I think therein really lies an important piece of that, and that's our own humanity, keeping our own humanity alive, and recognizing that if one person suffers, in a way, we all are at risk of suffering, and that tie-in with other people, I think, becomes an important piece of this puzzle. Great. We have one more question.
Yeah, so Louisa.
Al, I just want your take on this. So, you spoke about micro versus micro interventions, like the speech therapy, and macro. Do you think micro interventions would be way more effective if we looked at the macro piece of things?
No question, Louisa, that they are so powerfully correlated that one without the other is, I don't want to say wasting time, but one without the other is really, really going to make it challenging. And I think this has been the history of human services, because most of the efforts in human services, again, whether they be, disability issues, long-term care issues for elders, poverty-related stuff, mental health issues, most of the interventions have been micro. And it's like, well, let's try to get this person's bipolar situation under control, or let's try to help this person speak better, or let's try to help this person move more effectively. Let's get a better wheelchair for them. All of those things, as important as they aren't worth a hill of beans if there's not another side of the bridge, if there's not a soft place to land, right? So it's absolutely, I think it's absolutely incumbent upon us to recognize the holism of this challenge, and that means that we've got to understand community, and that in this series, in this educational series that Community Living Algoma is sponsoring, to me, the next session is important because it's about relationships. But session 3, 4, and 5 are really all about trying to get us to recognize the potency of community and the macro challenges in this issue. So there's no question, Louisa, that they have to be blended together, or we're just going to be kind of spitting into the wind. Terrible analogy at the time of COVID to think about spitting into the wind, but it's I just think we've got to be intelligent enough about this and holistic enough about it to recognize both sides of the equation. Great question. Thank you.
So Al, just in keeping with the time, there's only a couple minutes left. So any chats or questions that we have, that we can forward them to you via email, just so that you have them. So I just want to take this opportunity to thank everyone for taking time out of their busy schedules to participate in this session 1 on addressing loneliness and social isolation, a key to a better life. A lot of great information. And for those who didn't get the PowerPoint, just send me an email and I can send it to you. And it's also we're gonna send it out in our communication tomorrow. And just reminding everyone that, Al's been referring to the different sessions. So I will be sending that information out as well too. So on January 26th from 10 to 12, session 2 is building capital through social capital. On February 9th, we have session 3, which is community mapping, also from 10 to 12. February 23rd from 10 to 12, we have session 4 was understanding the social infrastructure. And on March 9th from 10 to 12, we have session 5, which is macro change, the key ingredient for community success. So we'll be sending out that information in the Zoom link so that everybody's able to join and attend. So once again, on behalf of Community Living Algoma, we are very thankful that you joined us today. And thank you, Al, for all your wonderful information and knowledge and sharing with us.
Thank you. Thanks so much, Tanya, for the opportunity to work so closely with your organization and for the courage that your organization is showing in terms of addressing things that we've kind of, swept under the rug. So thank you. Excited about it. Thanks everybody for being a part of this, and hopefully we'll look forward to seeing you at our next session on the 26th.
Okay, thank you very much.